So I'd like to share with you guys a case study that recently happened in my practice. And in this case, I used the gaze stability exercise to help this patient. So before we actually get right into exactly what I did with the Focus Builder app, let me just give you an overview of what this patient presented with. So I saw this patient for five visits over a period of 10 days. This is a female that's in her 60s, and her complaints are um, lower back pain, bilateral hip pain, right knee pain. She has significant swelling in her right leg, and that's been going on for about 2 years. And she also mentioned that she has difficulty elevating the right leg, so she'll tend to stub her toe in the carpet or the floor when she walks. She also had a fall about 6 weeks ago, which has enhanced all of her problems and certainly made it more painful for her to walk. So she has a hard time walking. She needs a cane or assistance um, to walk. Now, I did a complete exam on this patient, but let me just give you some of the relevant findings that I found. The pursuit left was performed, no problem. The pursuit mechanism was intact. But when she pursuits to the right, she actually does a head pursuit. So her head and her eyes track the moving target to the right, as opposed to only her eyes to the left. And we did the left one first, which was done perfectly well. So she knew what to do. When she went to the right, she did it with her head. When she protrudes her tongue out, the tongue deviates to the right. She has a right palate paresis. She has a right pyramidal distribution of weakness, and her reflexes are absent in the patellar and the Achilles on both sides, but the patellar reflex is only on the right side that it's absent. All others are normal. She has a right head tilt that is actually fairly pronounced. Optokinetic response is much slower to the right than to the left. So if you just look at the eyes, they bounce, they move to the right and to the left and up and down. But the amplitude up and down is much shorter, and the speed of the movement is much lower to the right compared to the left. And as I mentioned before, she has a right head tilt. So the treatment plan that I had and the treatment that I actually performed over the course of those five visits are first, I got her on an anti-inflammatory diet. I also use a class 4 laser, which is a hot laser to reduce inflammation in her knee, since that was her primary complaint. She also complained of back pain and hip pain, but the knee was really, I think, the primary problem. She obviously has a lesion in her right pons and medulla, primarily the right pons, but also the right medulla. So that PMRF, pontomedullary junction is compromised. And we have found also that in some cases, when you have a lesion in the pons on that same side, it can create a head tilt to that side. And so some of the other treatments that I've implemented were used a Pointer XL2, which is kind of like a TENS unit, but with like a pinpoint tip on it. And I used that on V1 and V2 and V3, 15 seconds 3 times. And then I adjusted her spine. I did some lumbar flexion distraction. I used the ATM2 device, which is an active therapeutic movement device to help stabilize unstable joints or help joints and articulation that are painful to move without the pain. And it's really, really outstanding. I can't recommend that enough. We did some right infinity with the arm and leg in counter phase, 3 sets of 10, and she also does those at home. From an eye movement perspective, I wanted to do something that would help to restore that right pursuit mechanism, and something that could help as well, restore activation of that right pons. And so what I chose to do is to use our gaze stability exercises. And I'm going to go over that with you in just a second. The outcome of her treatment was really good. She was able to walk. The very first visit, she could walk a lot better than she could walking coming in. She didn't need the assistance and didn't need her cane to be able to walk. Now, after 5 visits, I mean, she's driving by herself and she's walking and just able to function normally again. The right pursuit mechanism was completely restored to normal. The tongue is midline. Her head tilt has improved 50%. Okay, so it's not completely resolved yet, but it's getting there. And the swelling in her right leg is almost completely gone. So she's done extremely well. And really the take-home point here is that as we are about to embark into exactly what I did with the eye movements, if someone comes in with a physical peripheral complaint, if you address the neurological problem as well as the peripheral problem, your chance of having a lasting, successful outcome is significantly higher. So these are the settings that I used. I used the gaze stability exercise in the Focus Builder app. And on the right-hand side, you see there's 2 steps. The very first step is a saccade. So I know she can do saccades very well. I tested her saccades, they were great. It's the pursuit that's the problem. So I actually used a rightward saccade starting from, you'll see that number 4 lit up in blue there in that upper right grid. We started from point 4 to the 4 target, and we did a 1 saccade to the center number 5 target. And this is an express saccade. Just to kind of make it fun, you'll see that the target type is a monster set, so just to kind of keep it interesting for her. Initial pause, I made it hold 2 seconds. The final pause did not hold. And then I hit done, and I go to step 2. Now from the final step of the previous step, which is number 5 in the center of the screen, to number 6, which is that target dot on the right hand side, we're going to do a pursuit. So the great thing about doing a saccade before the pursuit, which is the compromise here, the compromise function is the pursuit, is we use a motion that she's able to do well in the same direction of the impaired one. And what it should do is it should help enhance the ability to do a smooth pursuit properly. And so we do a saccade first and then a pursuit in the same direction consecutively. And so you'll see here that I'm still using the monster set. I could change it if I want to. Final pause, initial pause is going to hold 1 second, final pause 3 seconds. And the pursuit speed is a 5. Okay, so I'm going to hit done. And you'll see now on the left hand side, this is what I saved it as, the sequence name. Now the repeat sequence is I'm going to have this whole sequence repeated 3 times in a row. And then the dot size, I picked a large one. The spacing's at 50%, but as she gets better, I can increase it to 75 or to 100%, which would put those targets, as you can see in the upper left corner there, they put them further apart. Let's keep it at 50 for now. I can save or reset any of that. So let's just keep it the way it is, and let's go ahead and perform this this exercise. Done and start. And this is what it looks like. Saccade to the right, followed by a pursuit to the right. Perfect. And this sequence is repeated 3 times. And I'm also having her do this at home at least 3 times a day. And we're over time going to increase the amount of repetitions. But this is where she's at right now after 5 visits, and she's doing really, really well. Okay, very good. I hope this was useful and helpful in your understanding of how to use this exercise.